Let's see. Young man way up there in the white shirt. Oh.
Senator Obama.
Yes, sir.
You expressed a great desire to reform national health care in favor of a government-controlled universal system. I'm wondering if you consider this an effective solution given the long waiting lines found in many socialist countries with such a system where it can take 9 months to get a simple MRI. My grandmother died because of universal health care. She was dying and she couldn't set a simple doctor's appointment. It took her many months to get the simple medical treatment that she needed.
Okay. Well, first of all, I think you may misunderstand my proposal. If you've got health insurance, then you can keep it. Now, I'm assuming you do, under your parents' plan. Am I correct? So you can keep it, and we won't do anything about that. Although what we will do is try to work with your parents' employers to lower premiums so that it becomes more affordable. On the other hand, you've got 47 million people without health insurance. I meet them every day. I meet parents who can't give their kids health insurance. And so they go to the emergency room if and when they get sick. And sometimes they're treated and sometimes they're not. And for those folks, I think we should, in the wealthiest nation on earth, have something available that will help them. And that's why I'm going to give them the opportunity to get health care that is as good as the health care I have as a member of Congress. And they will be able to choose doctors, but they will also be able to get regular preventative care and primary care that will actually over time lower costs, because part of the thing we rarely talk about is those of us who have health insurance, we're already subsidizing people who don't. It's just in the form of emergency care that then gets tacked onto your insurance premiums. And the average family is paying about $900 in extra premiums because you're supporting people without insurance. So we have the most inefficient healthcare system on earth, among industrialized nations. We spend much more than these other countries. I don't know what country your grandmother was impacted in. Was it Canada, England, France? Huh? Which country was your grandmother in? Sweden. All right. Sweden has much lower infant mortality rates, much higher life expectancy rates, and they're just healthier than we are, even though they spend per capita much less than we do. If Sweden spent as much as we did, there would be no lines at all with their same system. Now, I'm not advocating a government-run system right now. What I'm advocating is to make sure that everybody has access to care and that we lower costs over the long term and make it more rational. All right? But it was a good question.